Good morning, everyone. I'm Russell Myers, CEO of Midland Health, and I'm going to lead off today's Unified Command Team briefing. Today is Thursday, April 2nd, 2020. The days of the week are running together, I'm afraid. I'd like to begin by echoing the Mayor's thanks to our Chinese American community. Thank you all very much. You all know that personal protective equipment is a precious resource in this time in the hospital, for our first responders, for all sorts of folks who are taking care of patients, and every donation we get is a tremendous help. Thank you all very much. Lots of other donors have been very generous as well. We continue to see that. Every day now, weekdays, our hospital folks are manning a donation center at the Abel Hanger Pavilion on Andrews Highway, across the street from the hospital. We continue to get generous donations from all over our community, and once again, we say thanks. Some numbers to begin with today. Just short of 4,000 cases now confirmed in the state of Texas, and 16 confirmed cases here in Midland County. In Texas, there have been 58 deaths and only one here in Midland County so far. At the hospital, we have a testing site that we've had up and running for several days now. Now have almost 400 tests that we have administered. The results for about 3/4 of those are back. We're still waiting on a little over 100 exams. 13 of our exams have been positive. One of the things we've seen is that as we find successful lab testing facilities that turn around our tests quickly, they begin to get overwhelmed. They perform for everyone, and then the turnaround time slows down. So over the last couple of days, we have seen a slowdown in resulting, and we're hopeful that picks back up soon. Census in the hospital is 117 today. We had only 84 patients in our emergency department yesterday, an extraordinarily low Wednesday. But that's been our pattern over the last couple of weeks. ER traffic is down significantly. In our critical care unit, we have 16 patients. We have now a total of 20 patients who are considered persons under investigation. 10 of those in our critical care space that's separated specifically for COVID patients. 10 more in the medical surgical unit that also is segregated, for a total of 20. When Dr. Wilson comes up in a second, he's going to talk a little bit about a bit of a policy change we have for how we're cohorting patients. That's not necessarily representing a large increase in the number of patients, but rather a change in our classification system that he'll explain in just a moment. Ventilators, always of interest. We have a total of 9 ventilators in use in the hospital. 6 of those are patients who are on the COVID unit, and 3 other patients are on ventilators. A total of 44 standard ventilators are available, so 9 out of 44, plus we have another supply of 37 disposable or single-use ventilators in addition to those, so we still have an ample supply of ventilators. We've talked a couple of times about employees, those who are being either monitored or quarantined because of some level of exposure. As of today, we have 17 employees who've been asked to stay home, self-report, self-manage, work with our employee health group to determine when they're safe to return to work. Most of those folks actually were exposed in some other way, or they're being quarantined for some other reason besides exposure to a patient in the hospital. We now have 8 employees who have had some level of exposure but are asymptomatic and are safe to work with a mask and protective equipment. So we continue to monitor each of those employees every day. As I told you, a really significant increase in donations. We've been very blessed. We also have had some of our suppliers finally come through with personal protective equipment. As of yesterday, we're up to 138 days of available N95 respirators at our current use rate. That's about the highest number we've had since this crisis began. Of course, if the use rate goes up, those numbers go down fast, and we continue to be careful in managing access to especially N95s, but all of our personal protective equipment is carefully managed. We've had an update in our management of employees who are traveling. As you've seen, the CDC recommendations for high-risk areas have grown daily, and there are multiple cities now in the U.S., in addition to many international sites that are considered to be high risk. And so we put a rule in place asking our employees, if they have traveled outside of this state in any way to any place, they are to check in with our employee health folks and be monitored for a while, whether they're symptomatic or not. We're just trying to be as cautious as we can with possible exposure. You may have seen a report we heard a report yesterday from the State Department of State Health Services about a new study that had come out of Singapore where they were seeing evidence that people who are asymptomatic are able to transmit the virus. That's obviously, some of that work is still preliminary. Dr. Wilson may want to talk about it some more, but it's an opportunity for us to reinforce once again the vital importance of social distancing. Just because the person you're in the room with or standing behind at the grocery store isn't exhibiting any symptoms, that doesn't mean that they're not potentially carriers, and the possibility of infecting you or your family is real. Finally, to end my remarks, I'd like to give a little praise and thanks to our environmental services team, the people that clean the hospital throughout the facility, every patient room. These are people who are absolutely on the front lines. They've taken very well to the heightened expectations we have for disinfecting, for cleanliness in the hospital. We've had virtually no housekeeping staff who've called in sick throughout this time period. They're dedicated, showing up every day on the front lines, even training other employees who are not accustomed to doing cleaning work in how best to do cleaning and disinfecting where we have opportunities to use non-EVS personnel. So thank you very, very much to our environmental services team. We're very proud of you, and we couldn't do it without you.